Many people who have peripheral artery disease don't know they have it. And yet PAD, as it's known, dramatically increases the risk of stroke and heart attack. Researchers have found that stroke patients with peripheral artery disease are 3 times as likely to have a second stroke, a heart attack, or die a few years after having the initial stroke. PAD is a circulatory problem. It occurs when fatty deposits in the arteries restrict blood flow to the legs and feet. The disease severely limits the ability to walk. Tissue can die, and gangrene can set in, requiring amputation. Estimates suggest that PAD is increasing in every region of the world. Yet until now, there was no global study on its prevalence. The first one was just published in the Lancet medical journal. Dr. Alan Hirsch wrote a comment on the study conducted by researchers at the University of Edinburgh. He spoke to VOA via Skype.
No single study can answer that question as to why PAD is both so common and increasing in prevalence. But these authors and other research would suggest that it's a combination of a wider exposure to the risk factors that cause artery blockages, like smoking, high blood pressure, diabetes, and cholesterol.
But of all of the risk factors, he says, one stands out.
Without doubt, the most important one is tobacco smoke in all of its forms.
The research shows that peripheral artery disease is expected to continue to rise dramatically, and about 70% of those who have PAD live in low or middle-income countries, mainly in Southeast Asia and the Western Pacific regions. Hirsch says the study should be a call to action for public health officials around the world to start education campaigns.
When a disease is this common, the answer is usually prevention, and prevention starts with an awareness of risk.
The key, he says, is to persuade people to give up bad habits. Hirsch says that for a pandemic already affecting 250 million people, local, national, and international health officials have to start getting the word out now. Carol Pearson, VOA News.